And जैसे पलान सर ने सिखाया है, I'll start the session with a prayer or a 1 minute concentration, and then we'll start with that. Okay.
Hello.
थैंक यू। सर मुझे स्क्रीन शेयर करना होगा।
आपको होस्ट है ना?
You will be able to do it now.
So would start my presentation by paying my gratitude to the Lord and all my teachers. Objective of today's presentation is to see that what is an important of psychosomatic correlation, to understand the psychodynamic of hypertension and gastroesophageal reflux disease, and to integrate the different modalities for the effective result. So before I present the case, would like to say that I'm a homeopathic doctor, and I am doing more of a practice with the ideal homeopathy. So we are taking case history in detail. So you may find some of the details might not be relevant for hypnotherapy maybe, but this is the case how we take. So there's few important landmarks of the case. She's a 51 years old lady and had presented with the fluctuation of blood pressure. And whenever there is a fluctuation in the blood pressure, she used to present with a severe headache. And this has started since 2 weeks. Usually her blood pressure will shoot up to 130 to 96 mm of HA. She also present with the gastroesophageal reflux, which is since 10 years, with the worsening of symptoms on and off. She has osteoarthritis, bilateral knees since December 2019, and she is on painkillers since December 2019 till now, when I have defined case in November 2021. Left wrist thumb pain, it is wrist tendonitis. Since few weeks she is experiencing, and there is recurrent URTI with the allergic rhinitis. So these are the presenting complaint, but her main concern, so we went for a dinner to their house, and during that time we were discussing these psychosomatic aspects in my profession and all, and they thought that it is good to discuss her case with me, and because it is an ideal. When she had this fluctuation in the blood pressure, they visited MD physician, and MD physician said that it is because of your emotional disruption, and you should first try conservative treatment. We would not directly start with the antihypertensive medicines. So she had a history of blood pressure before, during COVID, because during COVID time, we know that it was, there were a lot of families which experiences the crisis. So during that time, her husband was hospitalized and they all were diagnosed COVID positive. And this was the period when she was quite anxious and her husband was like serious. So she Uh, she had hypertension during that time for 2 to 3 months, and then it was normal. So this was into the history. Her family history, paternal and maternal side. And maximum maternal side, it is more of a psychiatric disorder, schizophrenia, bipolar depression, Alzheimer. And paternal side, it is hypothyroidism, something like that. History of grief was twice. And I think somebody's mic is on.
మార్నింగ్ 8 కల్లా వచ్చేయమన్నారండి. మార్నింగ్ 8 కల్లా వెళ్ళాను.
Okay. She has history of experiencing deeper grief twice when she lost her father and lost her father-in-law. So in homeopathy, we take little history of life space. I'm just giving here the landmarks. Her father died when she was in 10th standard and had a grief, and was, as she was more attached with the father, she took responsibility and took care of brother and sister and all the finances of the family. She got married and had good interpersonal relationship with the father-in-law, who supported her a lot. Mother-in-law is more irritable. She tortures and taunts her like dawri nahi laye, ye nahi kiya, wo nahi kiya. She is quite biased against her and favors her daughters. She has 3 daughters, I mean 3 sister-in-laws. So she has a good otherwise interpersonal relationship with husband, father-in-law, and son. She is socially active and loves taking leadership and execute, as we have seen since her childhood. She is like that. So this is in nutshell. I have presented with her some of the mental aspects and the social situation and the physical complaints. Would like invite group member to, before I present my plan and how I have executed it, would like your participation, that how would you like to go about this case if this is your case?
Anybody?
Okay.
Would like-
Okay. These are few more inputs for the life space. Her father-in-law died in 2011. Since then she has, so I have defined case in 2021. So it is 10 years she is having GERD. So it was directly trigger when her father-in-law died. It was her only support, because father-in-law used to, chop the vegetables for her, would help her to dry the clothes and help her in household chores. Also, he was supporting her morally against the torture of mother-in-law and all that, when she used to weep or brood or have anger against her. She also helps her husband in the business. Banking and accounts, and she also helps her son who wants to start business. She had her own jewelry business, but she now can't go since 4 years. And as of now, situation is mother-in-law was chronically ill, but now she is being bedridden since the COVID times. It has been since 2 to 3 years, and she now doesn't allow her to go out of the house. She is very clingy, irritable, and demanding. Yes, so please now your participation.
Like naturally, she has lost her support system, and with the mother-in-law, becoming more, she's expecting much more, and now she has to take care of the person who she is not having a good interpersonal relations.
Correct.
So that adds to her stress, and her rest of the complaints like GERD most commonly happens whenever there is a sympathetic overstimulation, which leads to loosening of the cardiac sphincter of the stomach. And this leads to a very frequent reflux and reflux esophagitis as
Yes.
well. Second is arthritis. Baseline cortisol levels, if measured, in such situation, they would escalate. And cortisol by itself causes a little more of protein degradation and the muscle loss. This is very common, and it takes away the support system from the skeletal system, musculoskeletal system, and arthritis are very common. After that, a chronic stress leading to arthritis is very common. That explains the rest of the symptoms.
Yes. So thank you, Dr. Avnish, for excellent explanation about the psychodynamic of the case. Yes, anyone would like to say about like how they would like to plan for the therapy or how they would like to go ahead with this case?
Yes, I want some student to come forward, please. Anil, will you stop
Right.
for a moment?
Yeah, okay.
That I can see them. And it's a good way of making it interactive. Okay.
Nidhi, would you like to contribute?
Nidhi, you can say something.
All right. I practice psychology, right? So I'm going to look at it from the point of view of psychology. I definitely see a lot of trauma that the woman has incurred throughout her lifespan, and there are a lot of unresolved issues. Grief, boundary setting, assertiveness, not able to, voice her opinion in front of her mother-in-law particularly. So first and foremost, what I see is ego purification and ego strengthening, because once the person has inner strength, then they get that inner motivation ki, okay, things may get better. So a regular session of ego strengthening, ego purification, the script which is very popular among all of us, given by Dr. Palan, that is one thing I'll start with. I'll also start with some CBT related counseling, wherein I'll ask her to, I'll help her to develop some assertive communication skills and boundary setting. And as the ego strengthening sessions go ahead, like after 1 or 2 weeks, when I find the client is stable, more grounded, then probably if she is ready, we can explore the issues of grief, because simultaneously we are also, helping her with her communication and assertiveness, not communication exactly, but boundary setting and assertiveness, learning to say no, learning to communicate her feelings openly with her mother-in-law and not feeling constricted within herself. And then probably I rely heavily on ego states therapy and looking back into the unresolved griefs and trauma. So that is how I would address the issue.
Really? Thank you. Thank you for sharing, Nidhi. And that's how even in some of the ways, even I have dealt with this case. Okay. So it is always we define the case with the current state, and then we decide that what is the future state we want to achieve. Okay. So I asked this patient that what are your feelings? That what do you feel in this situation? So she said that she is feeling stuck, she is vexed, there is a lot of anger which is suppressed. She feels being disrespected, rejected, not loved and appreciated by mother-in-law. And she broods over all small conversation which is going throughout the, since her marriage. And her productivity is definitely reduced than before. So what I asked her is, what is that one thing will change in your life, will solve all the problems? And she said, naturally, it is mother-in-law which is source of all the problems in my life. And then after a pause, she said, not only mother-in-law, because I also know it is an external problem. but naturally my reactions too. So I am here because I realized my family members are also telling me that I need to change somewhere emotionally the way I react. So she was quite aware about her emotions and these things. So then I asked her, what do you want and to feel instead, if not being angry, if not being rejected or disrespected or something like that? And naturally, the first answer was she said that I never thought of that. And it is like, I don't want to feel stuck. I don't want anger or brooding. I want freedom from the disorders, but there was no terminology which she had. So then with the counseling and that, she said that, okay, I want to start a shop or being cheerful or want to enjoy my life or want a good physical health or something like that. And then she agreed to be assertive, and she understood the meaning of being assertive, rightly as Nidhi has said that in this case, which is required. So the goals were set mutually, being empowered emotionally, being able to manage mother-in-law practically. So there are different problems, emotional problems and practical problems. So when you are emotionally stuck, you cannot manage your practical problems. So first thing is to address the emotional problems, and then she is empowered enough to solve her practical problems. And then effective management of physical ailments, normalize and later on normalize the blood pressure, pain management, to reduce the pain and stop medication eventually. Okay, so this was her empowering journey for 8 sessions. We started with the psychoeducation and giving her that mind-body correlations, and she understood how her symptom and her language has been correlating with her exact disease process. As Dr. Avnish rightly pointed out, her support system has gone. Legs and knee joint are the support. And it is also indicating that she's been taking a lot of load of the family, even husband's business, mother-in-law's affair, health, and her sons also this thing. Also, she has her own business, and it is always in the background, which has been running, ki main nahi kar rahi hu, main nahi kar rahi hu, karke. So first session, we discussed that, and breathing awareness was given. She received it very well. It was a very good response with the breathing awareness. She was very happy with that. Then in the second session, we discussed. So first session, I gave her an exercise to write down a diary, to maintain a journal wherein she can maintain triggers. What are the incidences which triggers her? So overall, okay, it is mother-in-law, but there are a lot of small incidences wherein she might not be aware of. And so she maintained that. It was a more of a session of ventilation because she wanted to share a lot of things about a lot of incidences on the grievances against mother-in-law. So that has been discussed. The third session, we discussed about the cumulative stress, as Dr. Palan has taught us. And it was about chronic stress management and discussed those things. So stress management is not just only emotional affair, but it is also about your practically task management and time management, which I told her that it is not just only your anger, but it is also you are tied up so much in terms of one task and another task, and like in the house. And she also admit that there is a lot of tension in husband's business, which also she is been carrying. And so we planned all her task and timed it out. And she decided to delegate certain task or something, and PMR was given. The fourth session, we discussed about assertiveness and management of mother-in-law. What are the resources, internal and external resources she have, and what is that ultimately she wants to achieve. It was also about, all throughout the sessions, we were also discussing about purpose of life. That would you would she like to live her life the way she's been living right now? Or is there something higher to look forward to, which she always wanted to do or something? And she said that I wanted to learn Gita Ji, but I never had started. And this was the time when we were discussing about resources outside and internal resources and external resources. She could see those resources and she could mobilize them in the next session. So the next session we gave neutral trance. And we also discussed about interpersonal relationship, as Nidhi said, that boundary settings with even husband, with son, with mother-in-law and, sister-in-laws. So overall, this is how it was been spaced in time, in between. So it is combination of therapeutic intervention, wherein I focused more of a she was having hyper reflection in terms of her issue with the mother-in-law. Her husband is been appreciating her, her son is been appreciating her, but she is been constantly, more hyper focused with the mother-in-law's issues. So de-reflection was needed, and that was done. The channelization of energies, which was needed. She started with so these were the methods which were used for her management of the case. It was the cognitive shift wherein she realized that it is her irrational thoughts in terms of her interpersonal issues with mother-in-law. The de-reflection and channelization, assertive training, hypnotherapy, purpose and meaning discussion. So result, overall, in between, so hypertension, then it was stable by 4 to 5 months, I guess, 3 to 4 months. It was stable 130 to 134 and 80 to 84. In between, there are episodes when we have started that her hypertension shoot up, and I gave her homeopathic medicine, stock homeopathic medicine, amyl nitrosum, and that helped her to reduce her headache immediately, and so that she could manage those issues. Also for her GERD, I gave her few homeopathic medicines, and that has also managed when it was triggered. Okay, so she kept maid for, so maid was there, but she increased the time and she took care of mother-in-law, and she started, right. Okay. She delegated task. Her knee joint wrist pain reduced to nil. Almost now she is not on painkillers. GERD also significantly reduced. There are episodes, but they are less. And intensity has been quite less. And she learned, so she started learning. There was someone who started Gita Ji classes from Mumbai, and it was just during this time, and she said that since we are discussing about the purpose or something which I need to start with, and it is the same time when she got this opening. So she started those classes, and she was very, very happy by learning those things. She started regular yoga. She also started her shop again, and she's going for 2 hours by keeping maid with mother-in-law, and she's organizing her own business now. Okay. Yeah, all of her reports were normal except the cholesterol, which was 230, and she was given certain diet and exercise. Also exercise, so she has started, and some diet. So for osteoarthritis in 2019 and 20, she was taking these medicines, and 2021, when she came to me, she was taking naproxen and these medicines. And later on, subsequently, as the pain was reduced, medicines were reduced, tapered off. So yeah, this is the management of the case. Thank you all.
Very good, Anand. I could see your creativity in presentation. I would like to appreciate that. Taste is good, but uh, you are an artist by heart. So your that creativity is seen here. Good. I liked it.
Thank you, sir. Thank you.
Yeah. Veena, some comments from you will help everyone. Veena.
Yes, sir. Dr. Anil, it was a really beautiful presentation, and it was also very precise, very to the point. And just, I have one question. How many sessions did it take, or how long did it continue?
Okay, so my sessions are usually 45 minutes to 1 hour. And usually it is combination of psychoeducation, some counseling, and one session of 15 to 20 minutes, whatever we do, either PMR or breathing awareness or something. Yes, there are sessions when we were discussing about certain issues of like interpersonal relationship, or she wanted to discuss something in detail. We did not go for the intervention, I mean hypnotherapeutic intervention. So in this case, I had planned, it was almost 7 to 8 sessions, not more than that. Because I found that before coming to me, she was quite receptive. She chose me because she wanted to work on it. It was her readiness, which was which gave the result, I guess, because she was quite receptive and wanted to implement. It was just she needed some support and understanding that, yeah.
So, how many number of sessions?
I said 7 to 8 sessions.
And also, did you work on the grief? Grief
I did
counseling
not.
that you're saying that?
No, I did not work on the grief because, okay, in terms of grief, I could not see any active symptoms of the grief right now. And I could not see that effect of grief which has been stopping her right now from the performance, because she is quite active otherwise in lot many other groups. We were common in the AFS group, and she's been quite active and taking active leadership and all. Basically, she is been stuck with the mother-in-law, wherein she could not figure out that what is the way out there, and that was the active issue for her. And in this particular case, I could not see that grief was blocking her right now and was responsible for her hypertension or something.
Perhaps your suggestion for starting or her choice of learning Bhagavad Gita might have taken care of that.
Oh, yes, sir. And that has also told her that because I have planned few suggestions for her, we call it as a master session where we will give particular suggestions for the disease. So after neutral stance, I have planned for her hypertension and GERD and assertiveness. So I had planned SIC also. But she said that I no longer need sessions, because from Bhagavad Gita, I am getting so much of insight and so much of peace that I really don't need now further sessions. And can we put it on a hold? And whenever we required, I will come and tell you. And I said, that is absolutely fine. When you are on your own growth path, why not? Yeah, that's right, sir.
Anybody else would like to comment? Sanjay, you have something to say? Avnish?
Yeah, let others, finish, then I would tell something. If somebody wants to, the students are there,
Yeah.
so we would prefer them to.
Sanjay, would you like to say something?
Yes, sir. Am I
Yeah.
audible?
Yeah, you are audible.
In the sessions of hypnotherapy, are the vascular dilatation sessions are given or organ relaxation sessions are given? or overall tissue dilatation or perfusion? Any specific suggestions were given or only, and how they are useful? Means about hypertension. About hypertension and how they are useful. Hello.
Okay. So I think Palansar he answered the J's question ka. Yeah, Avnish sir.
So, actually, whenever we learn this physiological approach and we are giving affirmations or suggestions regarding the in hypertensives, we are talking about relaxation of the blood vessels. At that time, we need to also know the background physiology that the blood vessels which are causing the hypertension, we call them as the terminal arterioles. These are the smallest well-formed arteries after which the capillary network starts. There is a pre-capillary sphincter, and that is under the control of the sympathetic nervous system, as well as they have the receptors for the adrenergic hormones, the adrenal medullary hormones, adrenaline and noradrenaline. So whenever there is a stress, these hormones are also released, and they primarily contribute to increase in the blood pressure. We call it as the peripheral resistance is increased. So the relaxation itself, the progressive muscle relaxation or the pleasant imagination, as per the choice of the subject, whenever that is induced, it causes a central parasympathetic stimulation very well. And this by itself would reduce the sympathetic stimulation, the central sympathetic stimulation, which is very clearly seen in this case. If you would have, might be I was missing in between because I had some calls, but there would be some component of anxiety or hyperventilation or palpitation as well. That is, episodically, there is a central stimulation of the sympathetics. And when you are giving these sessions of progressive muscle relaxation or guided imagination, the central sympathetic stimulation goes down. As a result, there is a vasodilation. So itself would reduce the blood pressure. Second is, whenever you are sequencing the symptoms, I always ask the patients that what is your priority of, or the severity what the person perceives. So they will have their own priority, 1, 2, 3. Then I set my own priority as a therapist, keeping into mind that which one I can target the first. Because I believe that patients, when they come with a lot of expectations and they want instant relief on at least one of the symptoms. So your first session should be, elaborate enough that you give at least solution to one of the problems. And so make your own sequence that which one I can target easily. Once you have targeted your symptom, one symptom treated before the next session, it builds the expectation very high. So you have, and I always say that, don't expect the change like a medicine. The mind will work in its own way. So whenever the priorities are set by the patient, I say that, your mind is going to work in its own way. So your are the logical priority, but the mind has its own, subconscious has its own priorities. So that is how I trick them that, I find the symptom which is most easily I can handle. And once you are able to handle one symptom, the patient starts getting a strong faith that yes, that is created, that yes, next one is also going to go away. Third one will also go away. So that is how the you can guide the person further in the course. So that is what I had to say.
Renu madam, any comment? Renu madam. Madam, your microphone is mute. Hello. I think she's not responding. Okay. So good. Nidhi probably left.
She had some guests, I think she told me.
So thank you very much, Anil, and thank to all the participants.